We are learning all the time. Because we have experience with it, we assume we can do it well. Effective learning is not as intuitive as one would think, as most accepted practices are based on theory, law, and intuition. We will discuss things to be aware of when learning, specifically learning traps, and what you need to avoid. Trap 1. Illusions of knowing. Illusions of knowing is defined as a false sense of content mastery. Let's look at an example. This unattributed image was first published in the Blickende Blätter in 1982. What do you see? Do you see a duck or a rabbit? Perhaps a better example would be to assess if you could explain what the Dalai Lama does and why they're so well known. A common way in which you fall into this trap when learning is by reading and rereading. Yes, this includes reading things we've highlighted. Because you've seen something before, you might believe you understand it. In other words, thinking you know more about something than you actually do. The other name for this phenomenon is known as the fluency illusion. A more concrete example is illustrated in the study by Rebecca Lawson, published in Memory and Cognition in 2006. The study, titled The Science of Psychology, highlighted our shallow and unreliable understanding of everyday objects, specifically the basic design of a bicycle. In responses, critical errors were identified. These included the location of the pedals, the chain going around the front and the back wheel, and general frame of the bicycle being incorrectly drawn. This showed that individuals, although frequently exposed, may have a shallow understanding of everyday objects. The way to combat illusions of knowing is to make your learning more effortful. In other words, test yourself instead of rereading, as testing helps calibrate your judgment. Pause here and choose the images that represent a functional bicycle. Did you get it? Yes, testing does not feel comfortable, but numerous studies have shown that this practice improves learning by strengthening memory and improving retention. Trap 2. Learning styles. This refers to the theory that individuals learn differently, and that their best learning occurs when the information is delivered in a way that matches that individual's learning style. This is also known as learning preference, and is probably the best word for it. There are multiple models that outline different learning styles. An example is Neil Fleming's VARK model, where VARK refers to visual, auditory, reading, writing, and kinesthetic. However, there's no empirical evidence to support matching content delivery to a student's learning style. In other words, it would not be appropriate to teach first-year anatomy via podcasts because that specific student is an auditory learner. Matching content to preference to improve learning is known as the meshing hypothesis, which has been deemed by many authors to be a neuromyth. The best learning style or delivery method is best suited to the content to be taught. In other words, in the context of teaching anatomy, a multimodal approach is suggested. This could include a combination of self-directed learning, demonstrations and didactics, and cadaver lab. Trap 3. Believing that learning is not a skill. Learning is more durable when it's more effortful. This specific topic will be covered in more detail in another video. Essentially, strategies that require more effort and promote desirable difficulty improve learning. Examples include retrieval practice, such as testing and reflection, spaced repetition, and interleaving practice. As previously stated, ineffective strategies include less effortful strategies, such as reading and rereading, mass practice, and the promotion of learning styles. Trap 4. Memory errors and cognitive biases. A memory distortion is an umbrella term referring to the process that results in the false reconstruction of an experience or a learning. There are many types of memory errors, many of which are more relevant in the context of law enforcement. An example of this is imagination inflation, which occurs when one imagines an event or experience that then results in a false confession or false representation of events. Examples in education include suggestion, curse of knowledge, illusion of confidence, and illusions of knowing. We already covered illusions of knowing. Suggestion. This is when educators influence a student's thinking by using leading questions. Curse of knowledge. This occurs when educators make assumptions about a student's baseline or prior knowledge, specifically assuming that they have the same background or foundational knowledge. This leads to overestimating how much the student knows. Illusion of confidence or competence is also known as the Dunning-Kruger effect. This can simply be explained as those who are unskilled and unaware. This is a dangerous combination of characteristics to have in a health professional, as they have unearned confidence on certain topics and procedures. These individuals would subjectively rate their abilities higher than what they actually are. Avoid these traps by educating yourself about learning, memory errors, and cognitive biases. Metacognition, thinking about thinking, is the key to self-regulating and improving your learning.